Welcome to Positive Healthy Living. Today we will look at those who are most likely to die from COVID-19. Since January 21, when the first U.S. case was confirmed, there have been over 19 million COVID-19 cases and over 334,000 related deaths domestically. Needless to say, COVID-19 has made a massive impact on our lives. Restrictions, lockdowns, and simple isolation has made this time we will never forget in our country's history. It has affected all of us, but it certainly has more of a deadly impact on certain demographics of our population. So let's get into the list on those who are most likely to die from COVID-19. 1. Older people. Even though people over 65 count for only 14% of the reported COVID-19 cases, they count for a staggering 81% of COVID-19 deaths. In comparison, young people between the ages of 18 to 29 count for a notable 23%. That's almost a quarter of the amount of cases, but only 0.5% of deaths. In light of this data, travel and gatherings have been suggested as situations to avoid for our older population in an attempt to protect this most vulnerable group. 2. Middle-aged people. Age is obviously a factor with who gets impacted from COVID-19. It doesn't just kill the elderly. In fact, the death rate amongst people aged 50 to 64 is incredibly high at 14%. So those people in this age range should take as many precautions as possible to avoid conceiving COVID-19. 3. Men. Men are almost 58% more likely to die with COVID-19 infection than women. New research has found that the presence of antibodies that exist in males attack their immune system and may be the reason that men are more likely to die of a serious case of COVID-19 than women. 4. Minorities. Race and ethnicity play a major factor in who is contracting COVID-19. Minorities are being impacted by the pandemic at an alarming rate. In fact, 17% of people who died from COVID-19 were Black and 13% were Hispanic. Because of the unfortunate disparities in healthcare that minorities face, the African American and Latino populations in particular have a large disparity of COVID-19 cases and deaths. So much so that these populations are suffering more than 3 times as many deaths as the rest of the population. 5. People with underlying health conditions. According to the report from the Centers of Disease and Control Prevention, people with underlying conditions were overwhelmingly more likely to suffer serious illness and 6 times more likely to be hospitalized and 12 times more likely to die. Underlying conditions that are most serious and deadly with those who contract COVID-19 are those who have cardiovascular disease, diabetes, and chronic lung disease. 6. Healthcare personnel. COVID-19 has hit incredibly hard those people who are on the front line of the battle against this pandemic. The Centers for Disease and Control Prevention has recorded over 328,000 coronavirus cases and over 1,100 deaths amongst just healthcare workers. Considering our frontline workers are our first line of defense, it is imperative that we maintain the health of all doctors and nurses, because without them, we are all up Schitt's Creek. So there you have it. Those who are most likely to die from COVID-19. No matter what your age, race, or where you live, please do everything you can to prevent getting and spreading COVID-19. Please wear your face mask, avoid crowds, social distance, only run essential errands, and wash your hands frequently. Let's do our part so that we can all get through this pandemic safely. Did you have a friend or a loved one that is in one of these groups that we discussed? Leave a comment down below and let us know how they are coping with this pandemic. As always, don't forget to subscribe to our channel and make sure you hit that bell icon to be notified of all our new videos that we release. Thanks for watching, and as always, go live life positive and healthy.